aware, this session will be available on our website within a couple of days from now, hopefully, if not by early next week. And I will also be emailing it out to all of the people who registered for the event. So thank you. Thank you everyone for joining us for this session. This session is being presented by Student VIP, and it's all about the benefits you have as a graduate student. So I'm not sure how long this presentation will be, probably about a half an hour discussing. So before we get started, maybe just a couple little quick housekeeping notes. If you have questions throughout the presentation, feel free to pop them into the question and answer. And I'll either read them to Daniel or he might see them, and we'll just kind of try to answer them as we go. But if there's a lot of them, we might just wait till the end and do a little bit more question and answer at the end of the session. Reminder about Thursday is our final, well, not our final, we have confirmed just yesterday, we confirmed our Durham orientation for next Monday. So that information is on our website. So any Master of Management students that are online, that would be totally relevant to you because that is your campus, the Durham campus. So we've got orientation on Monday for that, but our big official orientation with the provost, the research office, the TGSA and Trail College, that is on this coming Thursday, the 26th at 10 a.m. So please be sure to join us for that. I think that's about it. I'd like to just do a quick little acknowledgement to the land that we all learn and teach upon. I'd like to respectfully acknowledge that we're on the traditional territory of the Mississauga and Anishinaabe. We offer our gratitude to our First Nations for their care for and teachings about our earth and our relations. May we honor those teachings. So without further ado, I'm going to introduce you to Daniel Kilby, who is from Student VIP, who's going to tell you about kind of your benefit plan as a graduate student at Trent University. Over to you, Daniel.
Hey, folks. As she mentioned, my name is Dan Kilby, and I am the marketing and communication specialist at Student VIP. What that means is that I'm the person that you may see one day if you're at a wellness fair or any sort of like real in-person kind of situation, or you want a question about your benefits. I'm definitely the person to reach out to. My background's in campus engagement. I used to be a student executive, so I've always loved connecting to students and really trying to empower the services that we provide. And so I guess what are those services that we provide? We'll get into that as we go through. For me, big things that I'm a big advocate for are strong access to mental health, as well as virtual healthcare. I think especially in this last year, we've all seen changes in how just how we expect and how to be treated by the healthcare industry, and how we want to interact with those systems. So those are the things that I'm extremely passionate about and excited to get into that with you folks. So who is Student VIP? Well, we are Trent's program manager for your health and dental program. What that means is that we are not actually your insurance provider. I'm not an insurance broker. My background is in marketing and campus engagement. We more try to barter with the actual insurance companies to get you folks the best rates, get you good deals, as well as provide the services, events that make it student friendly. Rather than just being an insurance company, we try to make it as student friendly as possible. We try to really think about what it means to be a student interacting with these plans and go from there. So that's like the bread and butter of what we do, is try to make the best make the best student facing programs that we possibly can. And I'll get into those in just a bit. So the biggest part of what we do is definitely the actual health and dental benefits, which all you folks are covered under. So what's that include? So this is stuff like dental. So you can go to the dentist. I know that for me, as a student at Queen's University just a few years ago, Up until I attended school, I was on the blessed life of my parents actually scheduled all my appointments. So I did not have the experience to know exactly what interacting with the healthcare system meant. My healthcare literacy was really, really low. And that's something that we're trying to aim to do is make sure you folks know exactly what you have access to. So that does include things like the dentist. You can get exams, wisdom teeth, all that kind of thing. And these are so like in a moment, I'll show you where to find them as well, because oftentimes it's hard to know exactly, will this dentist take my coverage? Which dentist is the best to go to? There's so many dentists out there. There's so many different providers out there that I'll show you folks a really cool trick in just a second. We also cover travel insurance, accident insurance. So travel, hopefully as soon as possible, we can get back to traveling. I'm a huge traveler myself. Love going anywhere that I possibly can. My days off outside of COVID, try to travel wherever I can. And I recommend it as soon as it's safe and healthy to go to. And every student who's enrolled in the plan does have access to travel insurance. A lot of people don't know this and sometimes even buy a second travel insurance plan when they don't need it. So definitely keep in mind that you, as a Trent student, as a Trent graduate student, you have access to that, as well as accidental coverage, extended health. So that includes things like vision, practitioners, ambulance, hospital stays, that kind of thing. And as well as like registered massage therapists. So that's something that's a big one, is having access to providers that aren't covered under OHIP, basically, or equivalent provincial coverage, is what we really try to go for. And one thing that in full details of what the percentage is and how much are available on studentvip.ca/Trent. On there, I'll show you. It kind of looks like this, that you should be able to see here. And you should be able to see here this video, which how it works is that playing for you folks?
No, it's not playing right now, Dan.
Okay. So I do apologize for that. I can, in a moment, I will screen share instead what you should be seeing. Yes, basically, what you have access to is something called the provider search tool. That allows you to basically get exactly where the closest provider is. So I'm just going to pause the share for a moment and just switch to Safari here. studentvip.ca/Trent, where now you should be able to see the Student VIP website here.
I think you just have to stop screen sharing the one and screen share your other one.
Right.
It'll pop up. We're still in your presentation.
Yeah. Do apologize for this. And Google Chrome. Okay, so cool. So I'll show you two cool things here just because I broke it into two videos, but we'll just do it live here. So basically this is what the website looks like. And so you'll arrive here. It's the Trent blue, all that. Here on the right-hand side, you can see the Trent student benefits logo. Right underneath, you see the provider search tool. I think this is the coolest thing in the entire world. So you can just type in like Trent University, and we'll go with dentist. So dental services right here. And we'll say within 50 kilometers. You press search, and it will not only show you all the dentists in the area. So this is where it's tagging you at Trent. It'll actually show these blue ones are the ones that will direct bill your plan. So these are the ones that, if they're blue and they say preferred provider, they offer discounts to students, as well as providing, so you don't have to pay out of pocket. So sometimes you see it where you have to go to a dentist. Like if you go to one that doesn't, you get your dental procedure done. You have to go make a claim, go through this whole process of getting all that work done. Wait pay out of pocket, wait for us to reimburse you. That's obviously still an option if you have a preferred dentist that isn't one of these. But these ones will just directly bill you for the services that you're looking for. So keep some money in your pocket, as well as like, it's just an easy way to know what the best, like where you're going to get the best level of care. And that's the case for all these different practitioners. So if you're looking for a massage therapist, if you're looking for a chiropractor, even like a counselor, those are options that you have, and it'll show you the nearest ones and which ones will actually direct bill your plan. So I think that's the coolest thing ever. And I really wish I had it at my school, because it's a lot of calling dentists and being like, hey, do you take my plan? And they'd be like, maybe come in and we'll get some details. And sometimes they're not even fully sure exactly how their interaction's working. Like if you're just calling the front desk, they may not be fully aware of whether they take the Trent student benefit. So it's great that these ones do, they do, and it's easy to find. The other thing I'm going to show you here, that was in the next video, is the eligible drug search tool. So oftentimes, so basically under the plan, you also get prescription drug coverage. So one thing that's super cool is this direct to you prescriptions, something I'm a big fan of. We will basically mail your prescriptions directly to you at a reduced cost. It's free to get prescriptions delivered to you, and they are cheaper than if you were to just go to a pharmacy. So way more convenient for a lower price. Definitely recommend it. But for example, if you're like, is my Tylenol covered? So you would type in Tylenol, and you can choose brand name or generic. And right from here, it'll tell you whether your prescriptions are covered under the plan or not. It'll say it right here. So this is eligible. So Tylenol number 1 is eligible. All these other Tylenols are also eligible. And you can search by the name or the DIN. And it'll also give you, in this case, there's not any generic ones listed, but if so, it'll list, generic ones that are more easily, lower cost and all that kind of thing. So those are 2 features on the website that are super handy. Definitely recommend it. While I'm here, you'll see this looking to opt out part. This pops up. Your folks' opt in and opt out dates are September 1st to September 30th. And I'll get to that in a little bit, what that means. What it will look like on the website is one of these little bubbles. So similar to how we have live chat, once September 1st rolls around, one of these will just instead say opt in, opt out. And that's where you go for all that information. If you get lost, if you get stuck, you can always go to the live chat. There's actually people here just a couple rooms over. They're really sweet, and they will get you the help that you need, direct you to the right resource. But it is right there. As well, there is a series of videos here under Welcome to Your Benefits. And they kind of walk through similar to what we're talking about here, how to make a claim, all that kind of thing, as well as what your coverage covers, like little tips and tricks, that kind of thing. So definitely check out those videos. I'll play one for you in a little bit. And yeah, so I think that's the main things that I need to show you here before. You have access to I Am Well and the Direct to You Health Hub. I'll talk about what those are later, but they're things that I am very passionate about. So yeah, that's a little bit of the website. The full coverage details are here. Any nitty gritty kind of insurance-y stuff is on here. So definitely use that. And then we will hop back here to the presentation. So like I said, prescription medications are also covered. And you should be able to see everything again. So yeah, this is what the website looks like. And yeah, so there you go. So opting in and adding family, what that means is family does have a specific definition. You can't opt in just anybody. It is a spouse, common law partner, or dependent child. So you can choose to add those people to your program, to your plan, for an additional fee during the opt-in period. That's September 1st to September 31st of this year. So basically, that allows family members to be on the plan. They get the full experience. There's not like any changes. There is an additional cost, but basically you get another person on the plan. I know for a lot of families, that's probably going to be really helpful. Probably for grad students, it's going to be the most likely demographic to have these sort of things. Yeah, definitely keep in mind the opt-in dates of September 1st to September 31st, 2021. We know that some of you folks may come with insurance already in place. Again, maybe it's through your parents or spouse or work, something like that. If you already have comparable coverage, you can definitely opt out. That's the part on the website that I showed you earlier, is definitely the best way to do it. And you will just have to provide proof that your plan is equivalent, and basically checks all the boxes. One thing to warn is, like, if you currently have coverage, you opt out, and then, something happens and you lose that coverage, there's actually no way to go back in. So it's definitely something that you should treat as a fairly substantial deal. It's a big decision to make, just because going back is a little difficult. Sometimes we're able to make something work, but in general, it's kind of, once you're out until the next policy year. Additionally, there is, like, for example, like if you get 80% off on dental exams, if you have two plans, that they would actually coordinate together so that you would just have 100%, right? Like, there's some benefit to actually just staying on, even if you do have coverage, just because coordinating them, sometimes things are like, 60, 70%. 100% is way better. No one likes having to pay for medical care, for sure. So definitely keep that in mind, and just remember that opting out is a pretty substantial deal, and that you can opt in your family, which is a super cool service. So how do you actually access the plan? There's a lot of ways to do it. So the primary is absolutely this benefits card. You can find these on the website. You can download a PDF, but in my opinion, by far the best way to do this, and what we're trying to really, really push people to use, because who really carries around? I don't carry around a wallet most of the time. I use my phone for everything. I use Google Pay or Apple Wallet whenever I can. And I feel like probably you folks are very similar to me and do the same thing. So our cards will actually work right natively within Apple Wallet and Google Pay. You can see right there kind of how that works. And they just show up exactly like any other card. Like, you can see, this is actually a screenshot from my phone and a coworker of mine's phone. So right there with my Best Buy and EB Games and Air Miles is my Trent student benefits. Obviously not actually Trent student. It's got some fake numbers on it, but it's still super cool. And then on the other side of the card, it actually will give you numbers that are super helpful. So if you need help with coverage related inquiries, the phone number's right there. So once you download the benefits card, that's like all you really have to do to get to really interact with the plan. Like, if you're going to do one thing, it's, download this benefit card. Provides like Spark Notes version of everything you may need. I know I'm somebody that loses phone numbers and stuff like that a lot, and you're never not quite sure who to reach out to. So definitely download this benefit card. How you do that is same on the website. You go to the main homepage, and then just click benefits card, sign in. It asks you a couple questions, and then you just press save to Google Pay or Apple Wallet. Super convenient. Definitely recommend it. I see that we have a question. If I won't be able to join. So for the plan, there's actually so basically somebody is joining in January, not September. Basically everything I said is true. The only difference is that your opt-in and opt-out dates are actually just in January instead. Everything else is basically the same. And if you'd like, if you send me your email, I can give you the all that information for a January opt-in situation. Like, it basically works the same. It's just in January instead of in September. So yeah, definitely something to take note of is that there are those two different ones.
Sitting in your lecture or tutorial give.
Are you able to hear this? Okay, cool. Perfect.
Yeah,
so I'm just going to play this video for you folks. What it covers is how to actually make a claim. So I'll play this for you. It's a nice quick video that we provide. There's 6 of them. If you want to go watch them in your own time, definitely recommend it. So I will play that for you folks right now.
Give you back pain. Treat
I'll
yourself
check that
with
out
an
too.
appointment with a registered massage therapist or a chiropractor. Do your teeth need a cleaning to remove all evidence of those late-night study coffees? Set up an appointment with any registered dentist across Canada to get your confident smile back. Are you traveling outside of Canada over the break? Travel with ease, knowing you are covered under your health and dental benefits. Depending on the kind of services you receive and what practitioner you visit, you may not have to file an insurance claim for yourself. Some practitioners or services will provide what we call direct billing. This is when the office or pharmacy has the ability to submit the claim right away on your behalf. Easy and convenient, right? If the service is covered for less than 100%, or if you have maxed out the specific service, then you will have to pay up front for the remaining balance left on your bill. If you visit an office or pharmacy who cannot direct bill to your plan, then you will have to pay for the service first, then submit a claim for reimbursement. Please note that some services may require a prescription from a physician or a specialist. For a list of services that require a prescription, visit the Your Coverage page on your health and dental benefits website. Making a claim is easy, and you can do everything from the comfort of your home using your laptop, desktop, or smartphone. You only need 3 things to submit a claim. Remember that benefits card we talked about earlier? You'll need this. It contains your policy number and your identification number. You'll also need your itemized bill of sale or receipt from the purchase or service. The last thing you need is a Blue Cross account. You must register for a Blue Cross account using your policy number and identification number. Just a reminder, your identification number is a modified version of your student ID number. To make a claim, all you need to do is take a photo of your bill of sale or receipt and upload it through the web portal or mobile app, and that's it. If you sign up for direct deposit through the Blue Cross portal or app, you should receive your money back within 3 to 5 business days. Your health and dental benefits website is a wealth of knowledge when it comes to your plan.
So yeah, basically things to take away from that video are the method of how you actually do it. So how you actually opt in and out of, or how you actually make a claim. And basically we make it as easy as possible. On the main page at the top, there is a section that just says make a claim. And it guides you through exactly how to do it, whether it's from the mobile app, whether it's on just, you're on a laptop, whether it's a fax machine. If, I'm sure you folks are jumping at the bit to want to use the fax machine option. All of them are great. The Blue Cross app actually is a good one for if you ever go to like a massage therapist. They actually will reimburse you in like real time. Like you're there at the massage therapist. They will reimburse you within like really, really quick through the app. That's one that we always try to recommend is going through the app for massage therapists and that sort of thing. Some of them are really, really quick. Some of them are 2 business days. So depends there, but definitely something to keep in mind. No one wants to be waiting a long time for money. So definitely huge there. And so additional services, some of these are things that I'm very, very passionate about. One of them that you have access to is I Am Well. So what is this? I Am Well it's integrated mental health and wellness. It provides Trent students 24/7 access to a mental health counselor. They're master's level counselors. So any time of the day you can contact someone. I know many times in my university career, student journey, I needed to talk to somebody. I know that I'm somebody who sometimes struggles with things like anxiety, and being able to just have an anonymous private person to talk to in person over video call, via telephone or live chat would have been so good. And basically you can do this at any time. Immediately you'll be relayed to a counselor. There's 240 languages available. So if English isn't your first language, you are able to get an interpreter who can, guide you through the process, as well as reach you to a counselor who speaks your language. So we try really, really hard to make sure that there's no session limits, that this program is for everybody, that you can always check in on. It's free to all Trent students and their families. and graduates. So if you know anyone who graduated who may need to talk to somebody looking for help with their mental health, definitely point them in the direction of the I Am Well app. It's a great program. And one thing that I think is super important, especially in 2021, as we're challenging a lot of things of how they currently are set up, is there is the option for culture matching. So if you are a queer person or a person of color and you want to have a counselor who sort of has your cultural context, understands your background, we will actually find you a counselor who matches your cultural identity. So it's definitely huge and a really good thing to pay attention to. And yeah, so additionally in the app, we tried to make it a full integrated mental health resource. So there is a mood log where you can track your moods. So you can say like, hey, I was sleeping today and it made me feel happy, or maybe it made me feel stressed. This test today made me feel a certain way, and it will actually track your trend data. So basically you'll be able to relay that to a counselor and say, hey, every Saturday I go down to study and it makes me stress. And that can be very helpful for a counselor, especially because we don't have those session limits. So you're able to just connect properly to resources on campus. We are integrated fully with the Trent campus. So if for whatever reason we think that you may need more specialized help or anything like that, we will actually direct you and relay you to that appropriate resource. We won't ever cut you off. If you are happy with your counselor, you can stay with them as long as you want. So that's something to definitely note, and diversifies us a little bit from the situation. I'm automatically covered through student VIP. We have a question. So Rakesh is asking, so being a full-time grad student, he understands that he's automatically covered through student VIP. If he wishes to continue it, do they still have to opt in after the 1st of September? No. So you don't have to opt in. You're automatically enrolled. It's more if you are looking to leave, you can opt out or add somebody. You can go that way. So something to note there. Definitely a good question. And yeah, so there's also a wellness library full of fully professional resources regarding mental health. So it's definitely huge. Please tell people about I Am Well. It's a great program. Everybody can have somebody to talk to. It can be, even if it's just wanting to talk to somebody for a little bit, it doesn't have to be this big thing. You can reach someone super fast and just say, hey, I'm stressed out about my homework tomorrow. I need to talk to somebody. That's totally cool and totally normal, and something that we encourage people to interact with the program with, not just when you're in crisis, not just when things are in dire need. Preventative care is super important, and self-care. So definitely practice that whenever possible. Additionally, in IML, if you're looking for some nutrition help or life coaching, financial help, legal coaching, especially financial help for when you're getting closer to graduation, they will help you with career counseling and that kind of thing. So definitely something to keep in mind. It's a fully featured integrated mental health and wellness program. So it's like, I love it so much. I really, really wish that we had it at my school that I went to undergrad at. So you folks are very lucky, and I really hope that you use it. And if you have any questions about it, definitely ask. Another program that's super cool is the Direct to You Health Hub. How that interacts is you can get prescriptions delivered directly to you via the virtual pharmacy that's powered by DrugSmart. So if you live off residence, they are able to basically ship prescriptions directly to your door. If you're on residence, it'll ship them to residents. So it's a super cool program, and it's actually cheaper than if you go to the pharmacy. So definitely do it. Also, virtual physiotherapy. So if you I know I played Quidditch in undergrad, and that was something that I was super interested in. And so that comes with injury sometimes, and sometimes you tweak an ankle wrong or something. And I know that a lot of people I played with would wait till December to go home to actually deal with, some sort of injury. you can just do it right from your dorm room. A physiotherapist will meet with you on video. You can show them like, a video call of your ankle or whatever and get that all figured out. And I think my favorite one is direct to you doctors. This is 24/7 access via video to a Canadian doctor. It's totally free. It's a fantastic program. There are two minor ailments in Canada actually has like a very specific definition. So it can they can write sick notes. They can prescribe medicine more if it's needed. Like it's a fully doctor. It's a full Canadian doctor that you're able to connect with. And they really need a doctor. You do it. You don't have to take for a special student. Like that may not that's super great. And all is
Well, it looks like Dan was having a little bit of a internet connection issue there. He was in and out, in and out. Let's wait a minute and see. Oh, here he comes back again. Good. Can you hear us, Dan? Hello, are you there, Dan?
yes, I can hear you. Hello?
Okay. Yeah, you were
Yeah,
getting
hello?
very high. Are you there? Okay. Can you? Okay.
Was I getting kind of robotic?
Yeah. Yeah, the last 30 seconds or so, your voice was very staticky. So I don't know how it's going to go, but we can keep on going and see if it's better. You're frozen again.
Perfect. I will try a little bit closer to the internet modem, ever so slightly. But yeah, so we also have these access. Am I human?
You're frozen, but your voice was sounding okay when you were talking.
Okay. That works.
Okay.
So yeah, we have basically these services that will provide you access to fitness as well from home. So that's like high intensity workouts, yoga classes, boot camps, that kind of thing, all from home, as well as hopefully this won't be needed too much longer, the COVID-19 screening, hopefully, and as well as vaccines. So direct to use a great program. We're always adding things to it. We're always making like new strategic partnerships, and all of this is heavily discounted or free. Like I mentioned, the pharmacy as well as the doctors who are able to, was I a robot when I was talking about the doctors?
No, I think just that's when it started.
Gotcha.
Yeah.
So yeah, basically it's 24/7 access to a full Canadian doctor that's free. Definitely recommend it. Lots of times when you're too sick to leave your dorm room or apartment, but maybe not sick enough to go to the hospital. And it's a fantastic tool for that. So that is the end of our presentation here. Anyone have any questions that they may have for me?
So that person that was asking about starting in January, did you recommend that he should or she should just get in touch with you, or do you want them to email us and we can get them in touch with you? I think their question was about starting in January or opting in or opting out at that
so
time.
they can totally email me. That's totally fine. My email is
Okay.
right here. It's Daniel, that's my name, at studentvip.ca. I can definitely get them the information there for opting or joining in January. And it's everything's the exact same. It's just the start date is different effectively. So definitely works that way. And then yeah.
We do have quite a few, like we'll be having more students starting in January term than we have had in the past. So yeah, that will be a common thing with our management and AMOD now have start terms in January and May. So
Right.
We'll have people starting at different times.
Gotcha. Yeah, that totally makes sense, especially now. And I see we have a couple more questions, but yeah, it's basically functionally the plan is the exact same. It just is in January.
Okay.
And opting in and opting out, it's you just do it, but just in January, right? So like instead of September 1st to September 31st, I believe it's around the same time frame too. I can grab the exact details for that like right after, and I can send them your way to send to all the people who attended for sure.
Okay.
So I have Jessica Scott here asking, so to clarify, to add someone onto our plan, the opt-in date would be in September, correct? Yeah. So if you have somebody to opt in, it's during September 1st to September 31st, unless you're starting in January, then it would be the January opt-in date. But yeah, if you are wanting to opt somebody in, the deadline would be September 31st. It starts September 1st. So definitely something to keep in mind. Don't want somebody to get missed. So Kendra's wondering about opting out. So you have healthcare covered federally. So that the specifics of what is covered depends on basically on a bunch of things, of certain checks and balances that make sure that all students have access to health and dental and that sort of thing. So if you'd like, Kendra, I can, I'll just send you my email. And if you just send me those details, I can reach out to our team and get you a specific answer for that problem, and figure out if that's something that we can, if that would be something that would qualify as alternative, for sure. Medications is the coverage for generic medications only? No. It's basically any medication. Like I said, so I'll answer this one live. Use on the website. It's called the eligible drug search tool. And it will show you which ones are covered. So a lot of brand name ones are, like when I searched Tylenol, all those were not generic. Those were the actual full brand Tylenol that we're saying eligible under your plan. So honestly, most stuff will be covered. And you can always check that area to see if your specific situation is. And in cases where it's not, we do have a form that you can fill out to see if we can move some of it over to that. So we try to be as flexible as humanly as we possibly can. But yeah, always check the eligible drug search tool. It's a great thing there. So thank you so much for your question. And yeah, so the opt-in date is in September. The cost to add a family member to the plan, it is, I will get the exact number for you. It is on the website. And so I can actually show it to you right now, where you would find that information. So give me one moment to just switch my screen share over. So now you should be able to see the Google Chrome window, and in which case I will show you where you go. So FAQ, so find a question or frequently asked questions. Go here for opt-in. It's right here. So yeah, so the winter opt-in date, it's going to be January 1st, 2022 to January 31st, 2022. So basically the exact same as September, but January. So that's good to know. And then as far as your coverage, sorry, my apologies. You go, how much do the benefits cost? So it is $478 to add a family member, basically. So to add a family member, it's $478. And you can see the whole breakdown there. There's a different cost if you're adding more than one. But in general, that's going to be what you're looking at.
And that's coverage for the 12 months. Is that right?
Yes, correct.
Yeah.
So basically they will, even if they're not a student, they basically will follow a student calendar year, because our policy years, no matter when you start, end in September, just how we end up having that work out.
Great. Are there any more questions for Dan?
So the coverage, so Ashlyn, the coverage limit depends a little bit on what exactly you're looking for. So like, if you press here on your coverage, it's if you see here, it's so overall drug, extended health, and vision maximum, it's 10,000 per year. So for $400, if you use it all, obviously it's going to pay for itself pretty quickly if you're actually using it. Each section will have specific ones. So like if you look here, drug maximum, it's 3,000. If it's something like, and also for this, like if what you're going to end up needing is more than 3,000, we do also have a form to see if you can raise that and lower some of the other ones and stuff like that. So if it is like a necessary medication, we do try to accommodate that as well. So hopefully that answers that question for you. If you go on the website here under your coverage and click on the specific section, so like extended health, it'll show you what each coverage limit is for each category. And then there's all this math. Basically the final total was 10,000, which is super great. The grad student plan is not different than the undergraduate plan. Basically there's some things that are more specific for graduate students, but for the most part, it's really, really similar. So if you were a Trent student in undergrad, you're probably going to be interacting more or less the same currently. So yeah.
Great.
Any other questions?
Oh, that was a great presentation, Dan. Very comprehensive. I think you've probably answered everybody's questions, and you've offered your email there. So if people have further questions, you feel free to, if you didn't get Daniel's email too, that I can help you with the answer. I'm sure the website will probably have answers to a lot of your questions, but you can always email graduate@trentu.ca as well. Or I think, Daniel, did you put yours in the chat? It was at the end of your presentations. It was daniel@studentvip.ca, correct? Yeah.
Correct.
So looks like we've answered all the questions. So if you have further ones, feel free to reach out to Dan or to ourselves.
And yeah, I'm honestly open like anytime if you ever have a question at all about anything specific, even like if it's not something that, a general question and you're like, hey, this is my situation. Can you inform me of how to sort of interact with that? Definitely email me. I'm surrounded every day by the people that do all the number crunching and all that kind of stuff. And I can definitely be like, hey, this person is wondering about this. Let's see what we can do to work that out. Like for me, my role is very much working with students, working with the actual campuses. So I'm basically a dedicated voice for you folks. So definitely reach out if you have any ideas or thoughts, even just like, hey, I wish we had this, email it to me and I'll see if I can get that available for you folks. Okay.
Amazing. Well, thank you. Thank you so much for presenting today. That's a really helpful overview for our students.
Awesome.
Yeah, so if there's nothing more, I think we'll sign off for today. And thank you for joining us. And hopefully we'll see everybody on Thursday at our next orientation event. Thanks, Dan.
Awesome. Thank you so much. Have a great rest of the week.
Thanks. You too.